autism is difficult to explain in a short amount of time, but it's basically a neurobiological disorder that affects children from birth onwards. We still don't know what causes autism, but what we do know is that it's not caused by any parenting techniques. It's not caused by something that a child can help. It's definitely something in the biology, the genetics, the neurology, the brain makeup of the child that causes them to have the symptoms of autism. And autism is characterized by children who have difficulties in three main areas. It's kind of called the triad of deficits. And that is, children with autism have difficulty either beginning to speak, so they start to speak later than typically developing children, or when they do develop language, it's unusual language. It's very repetitive. It's what we call echolalic, just saying the same thing over and over again. So children have difficulty in their language. Children have difficulty in the development of their social skills. So some children are very interested in having friends, but they actually just don't know how to make them. They don't develop social skills in an age-appropriate fashion. And other children seem to have less interest in actually socializing, and they prefer to be alone, and they enjoy playing by themselves and have a very difficult time integrating with other children. So you have a language deficit, a social deficit, and then all of the children have what's referred to as a limited behavioral repertoire, which implies that they have difficulty learning how to play, playing with toys functionally. They like to do the same thing over and over again, so they might be interested in, let's say, just lining up all of their toy cars, but not really playing with the cars, not developing a theme with their cars. Or they have very rigid eating patterns, they have very rigid thinking patterns. So all of the children who have any form of autism are going to have difficulty in those three core areas.